Next, I'm going to demonstrate the actual procedure on how to start an IV and what we do with labs. So the first thing you want to do is you're going to be giving your calculation using the master formula. And for the sake of time, I'm ordered to give 180 mLs using a 10 drop per ml solution set over 30 minutes. I did the math as you saw, and it comes out to 1 drop a second. So the first thing you always want to do is you want to explain the procedure to the patient. We don't want to just go up to them and start poking them with a needle. We got to explain the procedure. Ma'am, sir, I got to start an IV on you. Is that okay? You got to get consent, because without consent, it's considered assault and battery. So you get consent. You always want to ask things to kind of calm the nerves. Are you allergic to anything? In this case, we want to ask if they're allergic to latex for your gloves or alcohol, where we may use a different type of solution to cleanse the site. So we always want to ask if they're allergic to anything. And they're going to tell you no. You double check. Are you sure you're not allergic to anything? Normal saline, latex, alcohol along the way. No. So I got consent. I asked for allergies. I'm going to move on with my procedure. When starting an IV, it's about 90% prep, 10% procedure. So I always want to prep my area first. So with that, I want to make sure that I have my sterile dressing, which I'm just going to kind of pre-open up to have it ready for when the time comes. So I'm just going to leave it right there. I still have my sterile dressing, or my sterile coverings on it. I'm going to have the 20 gauge catheter, and on these IV arms and labs, we only use 20 gauge catheters because that's what these rubber arms are designed for. I have my Sharps container within reach. I have my venous constricting band, which I'm just going to place under the arm in the meantime. I have my alcohol preps. I have my IV bag and the correct drip set, which is, according to my calculation, it is a 10 drop per ml solution set, also known as a macro drip set. So I have all my equipment. The last thing I want to do is get my tape, which is going to help secure the IV tubing. So we want to use tape that's probably about at least 2 to 3 inches in length. I'm just going to put it right here. You can put it in front of your face on the cabinet. This is the easiest way to do it so you don't forget it's there. Okay, so just like with starting an IV, we got to get our bag ready first. So I want to check color, clarity, sedimentation, vessel integrity, expiration date of the bag. I'm going to open up the correct drip set. This is a macro drip set, 10 drop per ml solution set. I'm going to move my flow control to the top and shut it down. And the reason why I shut it down is because as I spike this bag, if it's not shut down, fluid is going to start rushing through that IV tubing. So now I'm going to take the sterile cap off of the IV bag, sterile cap off of the IV drip set. I'm going to puncture the membrane. I'm going to squeeze my drip chamber about halfway. I'm going to hold my IV tubing as such. And you can see as I open it up, nothing's coming out. It's because this bag has been spiked before and there's residual fluid. So I'm just going to give it a little squeeze to kind of get it going, as you can see right there. And now my line is spiked, or my bag is spiked, excuse me. So now it's time for the procedure. So now we got to talk to them. You always want to ask the patient where the best place to start an IV is. The patient knows their body better than you do, so they'll usually give you a little guidance on where to start an IV. In this case, it's going to be the left arm. So we always want to start distally and then work proximally. I'm going to apply the constricting band. And then I'm going to look for a vein that's straight, bouncy, non-rolling away from joints and arteries. So the only time for lab purposes that you need to look at these red bags or this tubing is when we're looking for a vein. So I have this vein right here, and as I push down, if you look right here, you can kind of see how there's an air bubble in there moving. That tells me that this is a good vein and I'll get a good flash. Now, if I find a vein right here and I'm pushing down on it, you can see how that bubble is not moving. That means that that's not a good vein. This has been beat up. So we always want to look for different veins in regards to lab purposes. So again, I'm going to push on the vein. You can see that's bouncing, which tells me I'm going to see a good flash. This was a bad vein. I'm pushing on it and I'm not getting any bouncing from the air bubble inside. It tells me that that is a bad vein. So once I figure out where my vein is, I kind of want to see where the vein is heading. So I can see that this is a straight, bouncy, non-rolling, and it's away from any joints and arteries. So that's where I'm going to go for my puncture site. For this procedure, we need 2 alcohol preps. the first alcohol prep is going to be for your gross decon. And you may have to use 2 or 3 different gross decons if you have somebody who hasn't showered or they may be homeless. And then the second one is going to get rid of any residual dirt that may be there. Now the proper way to do this is the 2-hand pop, the 1-hand drop method. I have my bevel up of the IV catheter. This is considered an over the needle catheter. And the way that I'm going to hold this is with my middle finger and my thumb, as you see right here, and my index finger is what's going to hold back the hub of the catheter so it doesn't slide on me during the procedure, as you see right here. So I'm going to stabilize the extremity, tell them they're going to feel a little stick. So you're going to feel a little stick on 1, 2, 3, going at about a 30 to 45 degree angle. And you can see that I have a flash right there. Now, what we want to do next is go ahead and land the plane, I like to call it, where we drop the IV catheter to the level of entry. I'm going to put my thumb on the wrist, my middle finger on the wrist as well, and I'm going to use my index finger and push the hub of the catheter until I can't push it anymore, as you see right there. Once it's pushed all the way, my index finger stays planted, and I'm going to pull back on my thumb and my middle finger until you hear a click. All right. My left hand is going to release a constricting band because I don't need that anymore. Now your partner or the instructor is going to come by, and if you do all these procedures correctly, they're going to drop these red bags for you. And the reason why they drop them is because of the pressure built up that when you remove this needle, it's going to cause issues. So what if you do all the procedures in the right way, this is where we're going to go. So next thing we want to do is we want to take our ring finger, non-dominant ring finger on the distal end of the catheter. Our index finger or thumb are going to hold the hub of the catheter right here, the pink part. And my middle finger is open, as you can see right here. I took the sharp. The sharp's going to go into the sharps container. I'm going to grab my IV tubing. The sterile cap is on the end. And the reason why I leave my middle finger open is because I'm going to take that cap, kind of sandwich it. I'm going to twist off. So now I have the tip of the IV tubing exposed. And I'm going to go ahead, connect it in, push. It's a lure lock. I'm going to twist it to the right about a quarter turn. And then what I always do is I look, once I have it connected, I look at my IV site to see if it's out, if it's kinked up or anything along the line. Because sometimes the IV line might come out from just doing the procedure. So this is your opportunity to go ahead and connect it the right way. Now, you never want to let go of this tubing, but I just want to show you something. Look at the natural tendency of the IV tubing. It's going to go up a little. So if I tape it down right here, it's going to cause that catheter to be exposed a little. So what I want to do is, once I know that this is the proper procedure, I'm going to take my first piece of tape, about 2 to 3 inches. I'm going to lay it over the top. I'm going to create a little bridge. So the natural tendency of that tubing, you can see I created a little bridge. And as I pull on it, it's going to hold it in place. Because now I need to check my 3 conformations. So I'm going to grab my IV bag. The first thing I want to do is open it up. So I'm looking at the bag. I'm going to open up about halfway. Is there flow? Yes, there is. That means there's flow going somewhere. Now I'm going to check the distal end of the catheter. I'm looking for infiltration. Is it blowing up into the outside cavity of the vein? It's not. And while it's still flowing, I'm going to drop it below the heart, and you can see I have backflow. Now it's going to turn a little more red as we go because some fluid got in there. I have venous return, which means I'm going to reinfuse my blood and then shut it down. Now you can see that my drip chamber kind of filled up a little more. So I want to be able to fix that. So I'm going to flip it over halfway, squeeze it, and then you can see, now I can see my drip set. So I went through my 3 conformations. It was flowing, no infiltration, venous return. Now I want to secure this line. That tells me that this line is good. So I'm going to open up my Band-Aid the correct way. Put that over the site. We always want to cover the puncture site first. And then I'm going to create my J-loop. We always want 3 different points of contact. And the second piece of tape, we don't want to put over the distal end of the catheter right here, because if it starts infiltrating, if the vein bursts, I want to be able to see that vein and adjust accordingly. And then the final thing, that's going to be my last IV tubing. So you can see that this is fully secured. And then my order, going back to the master formula, was 1 drop a second. So looking at your watch, you're just gonna set your drip set at 1 drop a second. Okay, we're gonna get as close as possible, and then we're gonna note the date, time, initials, update medical control, reassess the patient for desired or undesired effects. And according to my calculation, this is 30 minutes. So the time right now is 12 o'clock, which means I should be done with this IV start at 12:30. And I should have given that patient 180 mLs, which the line would be about right there.